Hello everybody and welcome to UCC's Dietetics Open Day. I'm going to be helped in the background by my colleague Erin Sullivan. If there's any guests that are in the lobby, she's going to let those individuals in. So we're very sorry that we weren't able to meet with you in person. We just felt that bringing so many people into CUH, into the lecture hall, was not safe during this time. So we're going to run this webinar online, and this webinar will also be recorded, which we'll put on our website after the meeting is over. I want to thank you all for your interest in this programme. We opened in 2020 and we've been overwhelmed with the volume of interest in this programme. So I'm hoping today will be informative for those of you that are interested in this career path. So my name is Aoife Ryan. I'm currently the Programme Director of the Masters of Human Nutrition and Dietetics at UCC. I'm also a registered dietitian, and I'm delighted today to be joined on this call by our three guest speakers, which are Fionnuala Muldoon, who's a senior dietitian in Cork University Hospital, working in the area of oncology. And we're also joined by Jean-Anne Nagel, who's a senior dietitian with a long career working in the community. So she's going to talk to us about her experience of working as a community dietitian, and Jean-Anne is currently a clinical tutor in UCC. We're also joined by Eileen Duff, who's a senior dietitian in Cork University Hospital, who works in the area of nephrology. So I've asked each of our three speakers to give us a sense of their jobs, what their day-to-day job is like, how they qualified, whether they enjoy it or not. And this is really a means for you to be able to gain some, what we would call, shadowing experience or some insight into the profession, which has become very, very difficult for our applicants due to restrictions around COVID-19. So today, I guess, is your chance to hear from dietitians who are working clinically in the community. And if you have any questions at all, please put them in the chat function. I think some of our speakers actually have to leave before the second session. So if you have any questions, put them in the chat, or I'll also have my email open on my phone here. And if you're too shy to put a question in the chat box, you can send me an email at a.ryan@ucc.ie, and I will keep an eye on that throughout the morning. So so it's just a quick look at today's agenda. I'm just going to briefly talk about, first of all, what is dietetics, and then I'm going to hand over to our three guest speakers who will speak for about 10 minutes each. We also may be joined at some point on the call from one of our first year dietetics students. They're in the middle of a lab at the moment, so she's going to step out and talk to us and maybe answer any questions that potential future applicants have. Then when we're finished with the guest speakers, I'll go through the UCC programme in some detail. I'll talk about the entry requirements. I'll give you an overview of the course and give you some information and tips on how to prepare a good application. And we'll also talk about career opportunities, the career structure, and we'll mention courses at other universities as well. I'm going to try and leave at least 15 minutes at the end for a Q&A. So as I said, put them in the chat function if you want, or send me an email. I'll put my email up on the screen in a minute, and I will go through those at the end and hopefully be able to answer most of them. So first of all, to start with, what is a dietitian? And I guess one of the most common questions that we get is, what is the difference between a dietitian and a nutritionist? So a dietitian, and it can be spelt in two different ways, is a healthcare professional who's qualified to give accurate advice and information on all aspects of nutrition and diet. So dietitians get a lot of training in both food, nutrition, physiology, biochemistry, medicine, social sciences, psychology, and their whole remit is to try and promote health, prevent disease. But I suppose what typically sets them aside from nutritionists is that dietitians are qualified to use diet in the treatment of several different diseases. So essentially what they're doing is they're translating all scientific information about food and nutrition into practical dietary advice. So if you fancy a career where you'll be working one-to-one with individuals, giving nutrition advice in both people that are healthy and people who have some type of a disease, this is really, I suppose, the course that you should consider doing. So most dietitians typically hold either an undergraduate degree in human nutrition and dietetics, or they hold a related science degree and then go on and do a postgraduate, either diploma or master's degree in dietetics. If you do an undergrad degree, these courses are typically 4 years in duration. There are some 3-year programs available in the UK, but they're typically 4 years. And of course, as you know, the points for these types of courses are it's very difficult to gain entry into undergraduate courses. The reason for this is the class sizes are very, very small, and so the demand goes up. So it is hard to get into the undergraduate courses. We understand that. So a lot of students will opt to do a science degree first and then go on and do a postgrad afterwards. And so there you're looking at typically a 2-year program on top of doing an undergraduate science degree. Dietitians, though, are the only nutritional professionals that have the title regulated by law. So the title registered dietitian, dietitian spelt with 2 T's, and a dietitian spelt with a C are protected by law, meaning that nobody can call themselves a dietitian unless they're registered with the appropriate regulatory body. So dietitians are qualified to work with both, as I said already, healthy and sick people in a broad range of settings. The vast majority of dietitians work in the health service, either in hospitals or in the community and primary care, and some work in private practice and industry. And I'll go through later the different kind of career avenues and salary structures, etc. So the vast majority work in the health sector or in private industry. Some dietitians also do want to work in education, so they go on to do PhD level or master's level research, and they go on to become lecturers, tutors. Some work exclusively in research, some work in, as I said, the clinical nutrition industry, and some work in government and consultancy. So dietitians are currently the only nutritional professionals that can be employed by the HSE. On the other hand, a nutritionist often holds a science degree or a master's in either public health nutrition, human nutrition, or nutritional sciences. And nutritionists or public health nutritionists are qualified to provide information about food and healthy eating, and often work in roles including public health, health improvement, health policy, the food industry, local and national government, as well as, of course, in education and research. However, the title nutritionist is not protected by law, and so anybody really can call themselves a nutritionist, and this is why we see a lot of people online or setting up practices calling themselves nutritionists who are not graduating from accredited programs. This is obviously under review at the moment. It is hoped that in the near future we will have a register for nutritionists in Ireland. In the UK, there is a voluntary register with the Association of Nutrition, which nutritionists qualifying from accredited programs can try and register with, but there is no register for nutritionists in Ireland. So I suppose the critical difference between a nutritionist and a dietitian is that dietitians really are the only healthcare professionals who have undergone extensive training, in particular clinical practice training, where they can work one-to-one with the public and also work with people with disease states. The INDI then is the professional organisation for dietitians in Ireland. It stands for the Irish Nutrition and Dietetic Institute, and you can only join this professional organisation if you are a qualified dietitian. They have quite a nice website with lots of resources on it, and I suppose critically for you guys, if you're interested in a career in dietetics, they ran an open day about 6 months ago, and the recording of this is available on their website. So if you are thinking of applying to a dietetics programme where you potentially will be interviewed and will have to write a personal statement, I really would encourage you to log on to the INDI website and watch that recording, because there was over 6 different dietitians working in a variety of different settings who spoke at that open day and gave some insight into their job. So if you're unable to get shadowing, which is typically the case for everybody now, this is a way of trying to gain some insight into the profession through looking at that open day online. So dietitians are, obviously the title is protected by law, as I mentioned, and CARU is our professional regulator. So to work as a dietitian in Ireland, you have to register with CARU. And if you see on this slide here, the statistics were updated in March 2021, and you can see there are over 1,100 dietitians registered on the CARU register. Unfortunately, this number is too low. It's not high enough to meet current workforce needs. So we have a critical shortage of dietitians at the moment. We've about 4 times as many physiotherapists and social workers. And so this profession is going to grow exponentially in the next number of years. And very recently, dietitians were listed as one of the core professions on the government website to allow non-EU members to come and work in Ireland as a critical, they're on the list of critical skills professions that we are short of. So CARU has a very important role in Ireland. First of all, it looks after and promotes high standards within educational programmes. So all universities offering degrees in dietetics have to meet very strict criteria laid down by CARU, and the process is very lengthy and detailed. And this is to promote, a high level of standard within programmes and amongst graduates. CARU also have a role in regulating qualified dietitians. They are required to maintain their registration. They are required to do about 30 hours of continuous professional development per year. So you have to continue learning right throughout your career, and it doesn't stop after your graduation. CRU also provides a pathway for a member of the public to make a complaint, if they have one, about a qualified dietitian, and this is then investigated through a number of set pathways, and a dietitian who's not practicing safely could come before the board of CRU and could potentially be taken off the register. So the whole aim of this is to protect the public against misinformation and to ensure high standards amongst our graduates and amongst our qualified professionals. So as I mentioned, we have over 1,100 dietitians on the register with CRU at the moment in Ireland, and the vast majority of these work in the public sector. We've roughly about 170 community dietitians at the moment, but this is projected to increase to over 270 within the next 2 years. And of course, we will have challenges recruiting this number of people, and these ads are being put out internationally now, trying to get dietitians to come to Ireland. It's hard to get exact figures on the amounts working in these settings, but over 400 work in acute hospitals. So if you study dietetics, most of the graduates would go on to work in the public sector, and about 120 or so work then in the private sector, usually with clinical nutrition industries. So these are companies that produce products that are used by patients. This would include tube feeds, intravenous feeds, and a variety of supplements that are used in patients with poor weight loss, poor appetite, but also very specific supplements for inborn errors of metabolism, etc. An issue we have within the profession, and one of our challenges, and we'd like to ask students about what are the challenges when we interview them, is that there's quite a high vacancy rate within the profession at any one time, because the profession is generally young females who are starting and having young families, and so a lot of the time we see dietitians out on different forms of statutory leaves to do with maternity leave or parental leave, and this reflects the age profile and gender of our profession. We're also facing a problem in the next 10 years where a sizable portion, about 10% of our profession, is nearing retirement, and so we will have issues obviously with continued recruitment of dietitians in the coming years. We're not very good at keeping waiting lists in dietetics, but from the information we can gather, there's about 12,000 members of the public on waiting lists for community dietetic services. So there's a huge demand, not enough dietitians employed, but this is something that's really been worked upon, particularly in primary care, with this huge investment in over 200 community posts in the coming months. In the clinical setting, in the hospital setting, dietitians work as part of the multidisciplinary team. This team is led by a consultant in a particular specialty, who also has a team of junior doctors working for him or her. Nurses obviously form part of this multidisciplinary team as well as nurse specialists. And then, of course, there are a variety of allied healthcare professionals on this team as well, one of which would be dietetics, but you would also be working closely with physiotherapists, speech and language therapists, occupational therapists, and pharmacists. And dietitians work in pretty much every area of medicine. I've listed some of them on the slide here, everything from diabetes to eating disorders, swallowing disorders, care of the elderly, pediatrics, cancer, surgery, ICU, transplant, intestinal failure, neonatology, maternity. So pretty much every specialty within a hospital would have a dietitian affiliated to a multidisciplinary team. So the job is quite varied, and a qualified dietitian can decide to specialise in any one of these areas going forward, whichever interests him or her. In the community, and we'll hear from somebody who's worked in the community in a moment, dietitians work in obviously patients who are not as unwell. So they tend to typically be better, they're living at home. And so working as a community dietitian can be quite varied. They would run a lot of clinics, either based in GP practices or in standalone primary care centres, where they would see everything from children with food allergies, growth issues, diabetes. Some of them you'll be seeing patients that are elderly, patients on home tube feeding, celiac disease, primary prevention of heart disease, seeing patients after they've had a heart attack, for example. Some of them work with disability services, some go out to schools, some go out to nursing homes, some work within GP practices, and some work in rehab settings. So the job is quite varied, and a lot of the time community dietitians will have gained some experience clinically in a hospital first before moving to the community, although that is not necessary. So my last slide before I hand over to our guest speakers is just from the INDI, and it shows you a breakdown of where graduates are working. So you can see in the blue, the vast majority of graduates go on to work in within the HSE or in the clinical nutrition industry. Much smaller amounts work in private practice, where they open up their own dietetic private practice. And we've obviously got a student membership and some that are retired or living overseas. So I'm now going to hand over to our first speaker, who I hope is on the call. Fionnuala Muldoon is a senior dietitian working with cancer patients in Cork University Hospital. If you have any questions for Fionnuala, can you please put them in the chat function or email them to me? I'll keep my email open here now, and I'll put them to Fionnuala. So I'm going to stop sharing my screen now and hand over to Fionnuala.
Hello everybody. I'm just having some technical difficulties. Sorry. I think this camera should be on now. Hopefully, oh, there I am. So I'm just going to have a quick chat, I suppose, about why I chose to do dietetics, my pathway to becoming a dietitian, and then what a typical day or week is like for me working in oncology here in the hospital. So my family are quite science-based. So my mum and dad both did science jobs. So I suppose I always was destined to go into something that was science-based. So I actually chose to do nutritional sciences first in UCC. So I did that back in 2004. And then after that, I went to Coleraine to do the Masters in Dietetics, which I finished in 2010. And then I actually, at that time, it was the recession, so there were very limited jobs in Ireland at that point, which is obviously quite different to what Aoife was just talking about there. So I actually moved over to Leeds to start working as a dietitian in the UK. So I started as a Band 5 dietitian working in medical area, so I suppose things like stroke, neurology, respiratory, elderly medicine and general medicine. And I suppose I had quite an interest in nutrition support, and a job came up at that time in the hospital in gastroenterology and oncology. So I actually got that job. So that was a specialist post that I started that in 2012, and it was split half between gastroenterology and oncology. And then after that, then I was able to get a full oncology post before then coming back to Cork in 2015 when jobs started to become available again after the recession. So I've been working in CUH now since then, so that's 6 years now, and I'm working in oncology. So that would be looking at patients with cancer, both in the inpatient and the outpatient setting here. So we would look at patients with a variety of different types of cancers, so things like GI cancer, lung cancer, head and neck cancer, blood cancers like leukemia and lymphoma, gynae cancers. And I suppose patients with cancer, we know that they need intensive dietetic support and access to a dietitian, and we're mainly ensuring that patients are getting enough nutrition to meet their nutritional requirements and maintain their weight throughout treatment. And that can often be quite difficult because side effects of treatment can impact your nutrition. So things like vomiting and nausea, diarrhea, poor appetite is associated with cancer. So they all can affect the amount of nutrition that people can take in. So we usually are doing nutrition support, so providing higher calorie, higher protein options, oral nutritional supplements, sometimes then needing to do tube feeding, like nasogastric feeding or PEG feeding, and then sometimes needing to feed through the vein, which is called total parenteral nutrition. And we would work across the day unit, which is where we provide, or where chemo is given, or radiotherapy. We do clinics on radiotherapy here, and then obviously the patients that are the most sick would be on the ward and would be admitted and would need to be seen by the dietitian, usually on the ward, to make sure that they're meeting requirements and they maintain their weight. We're also involved in things like prehab, which is getting people ready for treatment and ready for surgery and making sure that they're as fit and well and as able for treatment as possible. And also things like survivorship has become quite important in the last couple of years, which is around after treatment, and make sure that the patients have access to evidence-based treatment and ongoing support even once they've completed their treatment. And then I suppose as a dietitian we're always involved in things like research and audit and CPD, so continuous professional development, so things like making sure our practice is meeting standards and guidelines, making sure that we're keeping up to date with literature, researching journal articles, attending things like study days, and also then I suppose another big part of our job would be in delivering student training, so any sort of students that are coming from UCC or from Dublin that would come into the hospital for their placement, we would deliver a student training programme here, and that would be involved with the dietitians on the ward, but also in clinics where we would teach students and train students on how to be a dietitian and meeting their proficiencies to pass placement. So I suppose a role that I have as well in student training is being the student coordinator, so that's around devising the timetables and completing reviews and making sure that kind of overseeing the student training as part of the department. So that's really what I do from day to day, and I think our next speaker is Eileen, so I might hand... Oh, sorry, it's Jean-Anne. So I might hand over to Jean-Anne next, and if you have any questions, let me know. Thank you.
Hi, everybody. My name is Jean-Anne Nagel. Thanks, Fionnuala. I am a senior dietitian, currently working as a practice tutor on the Masters of Human Nutrition and Dietetics here in UCC. Thanks, Aoife, for organising today and asking me to speak. And it is amazing to see such an interest in the world of dietetics. It was lovely seeing all the numbers popping up there. I think is there, yeah, well over 100 anyway, listening in. So it's just, amazing to see. So today, similarly to Fionnuala, I'm going to speak about what led me to dietetics, my career pathway to date, which has been quite varied. And then I suppose for the purpose of today, I'm going to focus on my role as a community dietitian. I suppose this is where I've spent the majority of my career so far. And I suppose also just to offer a different perspective, as Fionnuala has just spoken about kind of the acute setting, and I believe so will Eileen. So I suppose firstly, what led me to dietetics? Well, I always had a love for science in school and had an interest in food. So again, similarly to Fionnuala, I went on to do the Bachelor of Science degree in nutritional science here in UCC. As part of that degree program, we did a 6-month placement in there was a 6-month placement as part of that, and I suppose I did my placement in a food lab. And although I really enjoyed that, I suppose I realised that it wasn't for me. I kind of thought I wanted to work with people more, and that's kind of what led me on to apply for dietetics. So at that time, there wasn't a master's or postgraduate programme in the Republic of Ireland, so I applied to the UK. So I went to the University of Chester and I did a postgraduate diploma there. And as part of my placement, so there would have been 3 placements across the 2 years, and I would have varied my placements across the acute and community setting. And I suppose that was my first kind of insight into the varied roles or opportunities that are available for dietitians. So once I qualified, I started working in an acute teaching hospital in the NHS. And I would have done rotations there such as stroke and gastroenterology. And after a couple of years there, I wanted to move back to Ireland. And similarly to what Fionnuala said, the recession was on at the time and there wasn't many career opportunities for dietitians in the Republic of Ireland at that time. So I actually started working in a nutritional company called Nutritia. So there I worked as a dietitian and an account manager. So I suppose that allowed me to gain some experience in the industry setting, and I actually spent 2 years there before then taking a career break and going travelling for a while. So when I came back, I took up a role then as a community dietitian, and that's where I spent the next 6 years before taking up a senior role in the child and adolescent mental health service, so the community mental health setting. So initially I would have worked in the primary care setting, and then I moved into the child and adolescent mental health service, which is also community setting. So I suppose I'm going to spend a little bit of time talking about my role as a community dietitian today, just to offer some insight into that area. So I suppose a typical day for a community dietitian is quite varied. In the primary care setting, I would typically start my day by setting up for my clinic. So I'd pull my patient clinic list, ensuring my room was set up appropriately for the clinic, so that I have all my resources and equipment needed. And I typically see about 10 patients a day. They would vary, I suppose the clinics would vary, whether it be at a GP site or in a primary care building. And I suppose I'd provide assessment and tailored advice to both adults and paediatrics for a range of clinical conditions. And I know Aoife mentioned some at the start there. So diabetes, weight management, heart disease, bowel conditions such as IBS, food allergy, weight management, and nutrition support as well. So having involvement in home enteral tube feeding. And as I mentioned, that would be for both adults and paediatrics. Another typical day might involve providing structured patient group education. So one group education that I was involved in would have been expert. So this is a structured education program for patients with type 2 diabetes. I would also cover a community hospital, so I would have an acute caseload there. And I would also get involved in nutrition-based training for other healthcare professionals, so such as MUST training for public health nurses. That's training in a malnutrition screening tool. So I would also in the week, I suppose, have some time for administration. You're quite an autonomous worker in the community, where you're kind of setting up your own clinics, and you need that time to kind of book in your clinics and your clients for the following weeks. Moving on to kind of the CAM setting, which was also in the community, CAMS at the Child and Adolescent Mental Health Service. I suppose there I provided assessment and treatment to children and adolescents with mental health problems, including eating disorders. And I suppose the main difference between this setting and the primary care setting is that the advice was delivered in clinics via an MDT, so a multidisciplinary team. And this was a really nice way of working. Overall, I suppose what I particularly liked about the community was the opportunity for continuity of care. So you really get the opportunity to take time with the patient early on in their treatment, and get to make a difference with them nutritionally, and also to their quality of life. I suppose you have the opportunity to use behaviour change techniques, which we would have received training in, and you work collaboratively with the patient to set and achieve common goals. I really liked, I suppose, the variety that the community setting offered. As I mentioned, you get to see a variety of age groups, so paediatrics and adults, and a range of clinical conditions, which I suppose really keeps you on your toes. And that leads me to, I suppose, what I really enjoy about dietetics is that I suppose the advice we're giving is ever evolving. And we're always learning to ensure that the advice we provide is the most up-to-date, evidence-based advice. And I suppose that's more important now so than ever, that we're registered with CORU, a regulatory body where we have to keep up to date with our, continuous professional development. If I was to think of any negative in terms of community dietetics, I suppose one thing I found at the time was it can be a little bit more isolating than, your hospital setting where you might be working as part of a big team of dietitians. But saying that, it really depends on the location. And as Aoife mentioned at the start, opportunities within the community is really growing and expanding at the moment. And there is a projection for many jobs to be coming down the line. So I could imagine team working evolving in the community setting as well. I suppose an area that I've been quite passionate about in dietetics has always been kind of education and seeking out opportunities to get involved in education over the years in the different roles. And so I suppose that's what kind of led me to my current role as practice tutor here in UCC. I've taken this post up in September, so I started in September just gone. So I suppose I hope I've offered some insight this morning. If anything, based on my varied career, that you can see that there really is a diversity of opportunities available for dietitians today. So thank you, and I suppose I'll pass you over to Eileen, I think, is it?
Hi, Jeananne. Yep.
Hi, thanks, Eileen.
Great. Hi there. So my name's Eileen, and I'm one of the renal dietitians working here with Fionnuala in CUH. And just a bit about why I chose dietetics. So I guess I always felt I wanted to work in a hospital and care for people. So I worked as a healthcare support worker for a few years, and got me into the environment of working in a hospital. And it really kind of led to me wanting to work in some professional capacity down the line. So originally I wanted to be a physiotherapist because I'm quite keen into sport, and then I did some placement on physiotherapy and realised it wasn't what I was looking for. So I kind of just started looking into what other areas and professionals there are working in a hospital, and dietetics was a great fit because it's an excellent lifestyle. So it's 9 to 5, Monday to Friday, and you kind of realise as you're going through your career that like that's very important. And some other jobs in the healthcare setting don't offer that, like a lot of work night shifts and weekend work and things like that. So that definitely is a positive. I am very big into cooking and very big into sports nutrition, so those areas really keep me interested and keen. I'm very keen to read around dietetics as well. Like, nutrition is ever evolving, so there's always something new to read or a new guideline to look into. So I went to college quite straightforward. I went into DIT and Trinity in Dublin and got my undergraduate degree there. I'm a bit like Jeananne and Fionnuala in the sense that the recession hit when I qualified. There seems to be a trend, and I went to the UK and started working in North Wales in a small hospital where I got experience in renal and I got experience in head and neck cancer and quite a varied rotation over there, and I really enjoyed it. I really wanted to work abroad because I think it's really good experience to get to know what standards and what ways of working there are in different hospitals, and you really kind of get to know what kind of a dietitian you want to be at the end of it. And I worked for 3 years there, and then I wanted to specialise in renal or oncology, and I got a job in Portsmouth in the south of England, which is a big renal centre where they provide transplants, and they're the main home hemodialysis centre in the UK. So got incredible experience over there, and I was there for 4 years, and then I decided CUH was the place to come to after that, and I've been here for 4 years, and I currently work as a senior renal dietitian, and a bit like Fionnuala, you get to kind of specialise in an area that you're interested in. So Fionnuala's particularly good at student training, whereas my area of interest is quality and audit. So I'm currently the QI and audit lead in the department, and with that I get to educate staff on the importance of audit and QI, and I've been incredibly fortunate to be involved in projects. I'm currently designing an app for renal patients on diet and activity. So I also was involved in developing an educational program for phosphate management in renal disease. So you do get your core working as a clinical dietitian in the acute setting, but you also get to work in specialist kind of areas of interest. So it is broad and it is varied in the dietetics world. So it is great for offering opportunities for that. My day-to-day work, I work on the acute ward, so I look after patients who may require dietary advice for renal disease mainly. So this could be in the form of low potassium advice. It could be in the form of nutritional support, so nutritional supplements or food fortification, and there's also patients who require NG feeding or TPN. So they form the bulk of my caseload day to day, but I also provide education to what we call pre-dialysis patients, so patients who are not end-stage renal disease, but maybe prior to dialysis may need some dietary education. So we offer that in clinics, and then we also offer advice to patients who have had a renal transplant or to patients who are on home dialysis therapies, so patients who may dialyse every day. So that's the bulk of what I do day to day, and if there are any questions, just let me know. I'll pass you back over to Aoife. Thanks, Aoife.
Thanks a million, Eileen. While I have you and Fionnuala and Jean-Anne on the call, there's a question coming through the email asking what are the requirements to specialise in an area of dietetics or to get into a specialist post? So can you explain how easy it is for an entry-level dietitian to get into his or her area of interest?
So I might answer that one. Fionnuala's here beside me. We're kind of having to communicate. So I would suggest you get experience. So it's very hard to know what area you enjoy straight off the bat. Like, so I would definitely suggest getting a rotation role. Like, you might go into an acute setting and really think you like oncology or something like that, and then you work in that area, and then you might actually prefer to work in renal, or you might prefer to work in a different area. So get as much experience as you can as a basic grade, and then consider specialising then. So get the baseline first, and then kind of consider developing. Like, there definitely are more roles to specialise available now than there were when we qualified. So it depends on the hospital you're in, or if you're willing to work in, let's say, Dublin, or you're willing to move area, or depends now. There's quite a lot of factors really.
So typically would it take 2 or 3 years to get to senior level?
Yeah, it's minimum 3 years. So you need to have 3 years experience as a basic grade, and then you can progress. Yeah. And
the second question, when you're on your placement, it says, can you request certain clinical areas in a hospital?
I'll pass that over to Fionnuala. Hold on a second. When you're on placement, can you request certain areas?
Hi everybody, it's Fionnuala again. When you're on placement, we try to give a variety of different areas to get exposures into. So we usually give a number of weeks in about 5 or 6 different areas. So that might include diabetes, renal, surgery, gastro, oncology, stroke, general medicine. So the kind of plan for student training is to have a suitable caseload, but in a variety of different areas. So you should be able to gain your skills and gain improvements in all areas. I suppose it's just finding suitable patients that are appropriate for students to learn from. But we do try and give a variety of different areas to get exposure. So then that hopefully will be the start of where you feel your interest might be before you become your basic grade dietitian, and then gain further experience there.
Great, thanks so much. There's some questions coming in on salaries for newly graduate students. I'll address that later. I have a slide in it. And there's some questions about prerequisite requirements for courses. So I'll address that in the second half. So I don't see any other questions for our guest speakers. And I think they're busy healthcare professionals. So we'll let them off the call now. And thank you so much for your time and insight into your jobs. And as I said at the beginning, there is also a recording on the INDI Open Day where you'll hear from another 6 or 7 dietitians working in a variety of areas if you want to hear a bit more about areas other than oncology, renals and community. So I'd encourage you to listen to that recording. So thank you very much to Fionnuala, Eileen and Jean-Anne for their time today. I'm going to now go back to sharing my screen again, and I'll talk about the career structure and answer the question that I just got there on salaries.
Thanks, Aoife.
Thank you, everybody.
Thanks, Aoife. Bye.
Okay, so the career structure in Ireland, and it's different in the UK. You'll have heard Fionnuala mention a band 5, band 6. It's a different career structure in the UK. But in Ireland, coming straight out of college, you're either called an entry level or a basic grade or a staff grade dietitian. So if you see jobs advertised using that language, it means a newly qualified dietitian. And typically people spend anything from 1 to 3 years, or maybe sometimes longer, in these staff grade entry level positions. And really a good dietitian manager managing a department well will allow these entry level dietitians to rotate amongst different clinical areas to try and get as much experience and exposure to different areas, certainly within a hospital setting. And then after a minimum of 3 years, you can then apply for a senior dietitian role. So this would be more subspecialized. So if you decide as an entry-level dietitian that you've worked kind of 6 months in diabetes, 6 months in pediatrics, 6 months in care of the elderly, or whatever it was, but you really like pediatrics, you keep an eye out then for any jobs that are advertised in the area you're interested in, and you would apply for those. So most dietitians would have permanent jobs by the time they get to senior dietitian level, and they're working within an area. So you saw that Eileen there is really only looking after patients in renal failure, where their kidneys aren't working. Fionnuala is looking after exclusively patients who have cancer. In the community, you can obviously also become a senior dietitian in the community, but as Jean-Anne mentioned, the job tends to be more varied in the community, although there are more specialist roles emerging in recent years. So a lot of dietitians will get to senior grade and stay at senior grade for the rest of their career. But there is another option to move up to a grade called clinical specialist dietitian. And at that level, really you're working within a very specific clinical area, and you've gained many years of experience in that area. And you would have more of a role in terms of coordinating dietetic care amongst the seniors or the entry levels in that area. You'd also have a remit to do a lot more research and audit. You'd be involved with student training, and these dietitians would typically tend to have a higher profile at national level. So they'd be working with the INDI, developing, specialist interest group days for dietitians to get further training in that area. So it's very, very specialized. And each hospital has a number of clinical specialist posts. Now, not as many. The bulk would be at entry level or senior grade. So there might be a handful of clinical specialist posts in each hospital. When those posts initially were developed, they were in areas like the burns unit in St. James's, or ENT surgery, or whatever, very specific areas. But more and more of them have come on stream in recent years. The post above that then, if you fancy it, is becoming a dietitian manager, and there are different grades within the dietitian manager scale depending on the size of the department you manage. So in a hospital, for example, like St. James's, they would have over 40 dietitians working there. So they would have 2 managers, a manager in charge and a deputy manager, if you like. And those managers typically tend to not have a clinical caseload. So they're not seeing patients, they're based in the department, looking after staffing, working out if someone's on leave, the cover for that leave, working with management of the hospital, the finance officers, the CEO, and developing new posts, putting together business cases for the development of dietetics, all that kind of it's more of a clinical admin role, if you like. And they'd obviously be involved in hiring staff as well. So that's the manager grade. So a question came in on salaries, which should be on the slide, sorry. So coming out of college, these are set salary scales. You can Google them. They're updated every couple of months as pay awards are given out. So if you Google pay scales in the HSE, it'll bring up every single healthcare professional working in the HSE, and these are the set salaries. So whether you go into the community or into hospital, you start as of October this year at 37,500 or so euro. You then climb the salary scale every year. You move up an increment, and the maximum on the entry level scale is about 54,000. Once you get to senior dietitian, you jump up. So even if you only spend 2 years as an entry level dietitian, but you get a senior job, your salary will move from about 38,000 to 54,000 overnight once you get a senior dietitian role. And then, as I said, there's increments every year. I think it's about 10 in total, up to a maximum of 64,000. Once you get to clinical specialist, and again, you probably would need to be a senior for at least 3 years before you'd even be eligible to apply for these types of posts. The salary is between 60 to 70,000, and managers, the salary varies depending on the size of the department and the number of staff that they are managing. So you're never going to be rich as a dietitian either, I suppose, but you're also never really going to be poor. These jobs are typically permanent jobs in the public sector, so you cannot be fired. So you have great job security, you have things like paid maternity leave. You see lots of dietitians working part-time, doing flexi time, job sharing, when they have young families, etc. So, and as Eileen said, it's a very nice job in that it's kind of 9 to 5 or 8 to 4, depending on where you work. No weekends, no night shifts, or evening work. So it's quite appealing, particularly to the female, I guess, profile of this profession. So as I mentioned already, the title is registered with Carew. So the title dietitian is protected, and you cannot work in Ireland without being registered for Carew. If you qualify in Ireland, the programmes at both undergrad and postgrad level will need to be approved by Carew, and so automatically when you graduate from these courses you can automatically go onto the register. If you decide to go to the UK to study dietetics and get your qualification abroad, you will have, and you want to return to Ireland, you will have to submit all of your application to Carew, and they'll have to look at everything from the course you did, the handbooks, all the placements you did, your transcripts, etc. And this can take several months for them to look at your application and to decide whether you're eligible to go on the register or not. But typically, students who go to the UK and do courses in the UK don't have any issues registering with Carew because the education programs are very, very similar. You then also have to undergo Garda vetting, which again can take more time, and that is unique to the site at which you work. Just a quick look at the jobs market. Our guest speakers mentioned how the recession really had a big impact on our profession because there was a moratorium on hiring right across the HSE, which meant that managers in any discipline were not allowed to advertise new posts and fill posts of people that had left. So for a long time, there was issues with graduates getting jobs, but this has dramatically changed in the last 5 years. I know a lot of you are probably young and you're not even using Facebook anymore, but if you happen to have a Facebook profile, there is a group called Irish Nutrition Jobs, which you can join. It's a kind of a closed group, and they put up jobs pretty much every day. So I had a look yesterday to see what kind of jobs have come out, and since the 1st of November you can see there's a variety of jobs in both you can see all areas of the country in both adults and pediatrics, entry level and senior, very specialist posts. Like in Galway there was a job for a bariatric dietitian, so that person will be working with patients undergoing obesity surgery. There's also jobs with Nualtra and Nutritia, which are two clinical nutrition companies which provide kind of tube feeding equipment and nutritional products. Jobs within the charity sector, government agencies like the Irish Heart Foundation, and they are still trying to fill over 200 senior community posts in the Dublin-Kildare area, which is having a knock-on effect on hospitals because some hospital dietitians are moving to the community, and this is creating vacancies then within the clinical sector. So it's a really good time at the moment to be studying dietetics and to be qualifying as a dietitian. And there's a lot of workforce planning going on within the INDI, and they're saying that we need to graduate at minimum 80 dietitians a year, if not preferably 100 or 120, to even begin to address the demand for employees at the moment. As a dietitian, you can also work abroad. So if you fancy traveling for a year, this means that, you potentially could work as a dietitian abroad instead of perhaps working as a waitress somewhere. So you'd be on a proper salary with nice hours. The INDI has a reciprocity agreement with the American Academy of Nutrition and Dietetics, meaning that if you are a member of the INDI, you can apply to the Academy of Nutritionists and Dietetics to have your qualification ratified. And I follow this career path myself. I did the undergraduate course in dietetics, and I moved to New York back in 2008, and it was a very straightforward process for me to get registration in the United States, and I was able to work as a dietitian over there with just sitting one exam. It was an MCQ exam to get on the RD register. So it's quite straightforward going to the US. There's a huge demand for dietitians over there as well. But just to say that from 2022 onwards, if you are thinking about going to work in the US, you will have to have a master's degree to be able to go on the registered dietitians register. So this may affect people who have just an undergrad degree. Dietitians also can work in Australia, the UK, New Zealand and Canada. They can work in any country, of course, but I suppose the main English speaking countries where they would have very similar training and career profiles would be these countries. And most actually countries, including the US, give you about 6 months or so window to take the RD exam. They're typically MCQ style exams, and then you go on their register. So they often give you that window opportunity where you can begin working while studying for the exam, and the exam is pretty easy to pass once you've got your qualification already. So how to qualify as a dietitian? There's some questions coming in here by email, which I'll come to at the end. So as you all probably know by now, we only have one undergraduate course in the Republic of Ireland, and that is the course at TUD or Trinity. The points are extremely high for this. I studied this course over 20 years ago, and I can tell you there was only 5 points of a difference between dietetics and medicine even back then. So historically, it has been incredibly high points, up there with the highest points courses. And this is nothing to do with how intelligent you need to be to do this course. You do not need, 8 A1s to get into this. It's got to do with the class sizes are very small. And the reason they are small is that each student has to complete a minimum of 1,000 hours of clinical practice training. And we just don't have enough sites to complete that training. So this limits our class sizes on both undergraduate and postgraduate courses. So if you do not get into the undergraduate course, there are now, I'm delighted to say, we have 3 postgraduate programs, one at the University of Limerick, one at University College Dublin, and one in UCC. The newest one is our own one in UCC, which I'll talk about in a little bit more detail later. But the UCD one is up and running for a number of years now. And both the UCD and the UL, of course, have full CRU approval. We're on the brink of it here in UCC, and again, I'll touch on that later. These programs typically have class sizes, again, of less than 20, so they're highly competitive. We get a ton of inquiries about our course, a ton of emails, a ton of inquiries coming in through our email address. It's a very, very popular course, but unfortunately, again, our class sizes are limited. And so if you're thinking of applying to a postgrad program, I really would encourage you to apply to more than one place. Try and apply to as many places as you think you'd be willing to study at, just not put all your eggs in the one basket. We get such high caliber applicants. It's always a really difficult decision trying to come up with our final class. So please apply to several programs. We have fantastic working relationships between UCD and UL. As program director, I'm in touch with the program directors there all the time, and we very much love to see high caliber students coming through. So I love to hear of students getting into these programs. But of course, if you can't get in Ireland, there are also a number of courses available in the United Kingdom. There is 11 undergrad programs. Some of these are 3-year programs. Most are 4-year. And I'll come to questions later, but sometimes we get a lot of questions from people who do not have a science degree, who come from, say, marketing or business, and they want to get into a master's program. Unfortunately, nearly all master's programs require a science degree with a significant component of physiology and biochemistry. And so if you are that candidate where you've studied, a non-science background, but you have a degree already, the fastest route for you to take is to do an undergrad program and to look into these 3-year programs in the UK. Otherwise, you'd have to do a science degree and a postgrad in dietetics, which would take years. So if you're interested in applying to the UK, there's great information on the British Dietetics Association website. So if you just put into Google British Dietetic Association, how to become a dietitian, it will bring up their webpage where it lists all the universities with links to each individual course, and you can have a look there. So if you're applying to UCC this year, or I would also encourage you to please apply to the UK if you feel that this is really what you want to do, because as I say, we do have to turn down very high quality candidates, and I always love to hear that they did get in somewhere. But please bear in mind the cost of living in the UK as well, particularly if you're looking at London-based courses. We constantly hear from students that it's exceptionally expensive to live and study in London. So you need to bear that into mind when you're looking at the fees across programs in the UK and Ireland. The fees are probably slightly higher in Ireland, but the cost of living would be a lot lower. So just briefly looking at the 3 programs within Ireland. In UCD, it's a 2-year MSc. You must have significant physiology and biochemistry as part of your undergraduate degree. So if you are currently a secondary school student and you don't think you're going to get enough points to get into the undergrad course, you need to choose a science course that will give you enough physiology and biochemistry. And a really good option to do that is to try and do an undergraduate course in nutrition. But if you don't want to study nutrition as an undergrad, you could consider something like physiology or biochemistry as your undergrad, and then try and get into a master's program from there. The class size in UCD is between 16 to 20, and just of note with this course is it begins in the January of every year. So if you come out of your undergrad program in June, you'd have to wait until January for this course to begin. University of Limerick is also a CRU approved course. It's again a 2-year master's. It also requires a minimum of a 2-1 science degree. And for the secondary school students, that means that you will have achieved an average of 60% or more in your undergraduate degree in your final exams. They require, again, evidence of physiology and biochemistry. It depends on the university, and you need to go onto each individual university's website to see exactly what the requirements are. But typically they require about 10 credits of physiology and 10 credits of biochemistry, which is almost like 2 physiology modules, or 2 human anatomy modules, or 2 modules in biochemistry. The class size in the University of Limerick is between 16 to 18 as well. The application deadline is April. I don't know if it's open yet, and they start their course in September. Our UCC course opened in September 2020. It followed 3 years of planning, in which we spent a huge amount of time trying to secure clinical training posts for our students. So that was the biggest hurdle we had to overcome, was to get hospitals on board and community settings which would take our students on practice placements. And so we delayed our opening until we had all of that organised. And so we opened last year in the middle of a pandemic. Unfortunately, we had to open online, but we're now fully back face-to-face with the current first years. So it's a 2-year master's. Our class size is currently 12, but it's increasing to 14. So if you're applying at the moment with a deadline in January, there will be 14 places available. We require, again, a science degree, preferably from a human biology related discipline, with a minimum of 2-1, which means you need 60% or more in your final exams. Although typically we tend to get a lot of students with first class honours degrees. I'll talk in a second about Carew approval, but we're in the very, very final stages of that, and we hope to receive final notification of that in the coming weeks. So the staff at UCC is led by our head of school, Professor Meg Kiley, and we have 3 full-time dietetics lecturers. I'm joined by Dr. Magella O'Keefe, who's a senior lecturer and who came to us from King's College in London, where she was a lecturer there on the dietetics master's and undergraduate programme. We also have Dr. Samantha Cushion, who's also a registered dietitian, teaches full-time on the programme. We have 2 practice tutors. I'm sorry I don't have a photograph of Adele. You've heard from Jean-Anne already. Both of our practice tutors work 3 days a week, and they support our students out on their clinical placements. You'll also get lectures from approximately 58 other professionals, about 30 of which are not dietitians. They're mostly medical doctors who provide expert lectures on our medicine module. And there's about 28 or 30 or so dietitians who give very advanced level lectures on very specialised areas within dietetics in our programme. This is our 2nd year class. This photo was taken at the very end of the first placement of first year. It was a lovely sunny day in July, where they came to present their projects on the last day of their placement 1. They are finishing their 2nd placement tomorrow. So they have just 12 weeks left to go next semester on their final placement, and they have to submit a dissertation as well. So they're over halfway there at this point. So just to look in brief at the programme, and all of this is really given in a lot of detail on our website. So it is a 120 credit master's. In year 1, students take 60 credits. So semester 1, which runs from September to December, is all taught content, and students take 30 credits of lectures, which I'll show you in a second. Semester 2 is also a taught module, which is 25 credits. So really in year 1, you're in university getting lectures and labs full time. Then you go out on your first practice placement at the end of May in first year, which is a 7-week placement worth 5 credits. So that brings you to 60 credits for year 1. Year 2 is also 60 credits. So you come back in September of year 2 and you begin your 2nd practice placement, which, as I mentioned, finishes tomorrow for our current 2nd years. And this is more of an acute placement. It's out in the hospitals, and I'll touch on those in a second. And they also do 1 taught module, which is a very advanced dietetics module on very clinical specialist areas. Semester 2 and 3 then, so after Christmas, we send our students out in groups on their final practice placement, where they finish off their hours for Carew, but they really get to hone and perfect their clinical practice and placement skills. And this, by the time they finish their 3rd practice placement, they're well able to work in any setting really as an entry-level dietitian. They also have to complete a dissertation because this is a master's programme, so they're given a research topic at the beginning of 2nd year, and they have some input into this, so they get to express an area that they're interested in, and we try and come up with a research project based on their interests, and they have the full year to complete that dissertation. So this year our projects are on things like the 2 projects on cystic fibrosis, we've projects in cancer, we've projects in food choice at work, so there's a variety, and we really do try to match projects on weight management, for example. So we try to match our students to their area of interest. This is just a brief look at the structure of the program in year 1. So all of our students come in with a science degree with a minimum of 10 credits of physiology and 10 credits of biochemistry. In semester 1, they do a module on nutrition assessment in the clinical setting. I'm sorry, my pointer is not working. Oh, here it is. So they take this module, which is all about how to do nutritional assessment in the clinical setting, 1-to-1 with the patient. They do 10 credits on professional practice and interpersonal skills, so developing communication skills. They get training on behavioral change therapy, etc. They also take a 5-credit module on medicine, which is run entirely online, and the lecturers are all medical doctors. So it's giving you a snapshot of medical backgrounds, which you will obviously need to work in a clinical area. And they also take a 5-credit module on dietetics through the life cycle, where we look at all the dietetic issues that can come up from pregnancy right through to old age. They take 1 elective module, and this depends on their background. 1 is a metabolism module and 1 is a health promotion module. And if you get into the course, we'll talk to you more at that stage about which elective to choose. After the Christmas holidays, they come back and take 10 credits of advanced medical nutrition therapy, which is really the main core dietetics module. It goes through lots of diseases and how they're managed from a dietetic perspective. They also do a food skills module, which is mapped in the correct order, so that if we're covering, for example, celiac disease in advanced medical nutrition therapy, we do the practice of this in the food skills lab. So this involves cooking skills in a kitchen where we prepare food for a variety of different diseases. They also take a 5-credit module on public health nutrition, so all about the epidemiology of disease and how dietetics can manage it. And they also take a research module, which helps them prepare for their dissertation in year 2. Then in semester 3, which begins at the end of May, they go out on their first practice placement, which is 7 weeks in duration. And this placement is on health promotion and the food service. So we have lots of placements in community settings with community dietitians, with charitable organisations, with patient groups, patient group organisations as well. And they do some food service, so they spend some time, typically 2 or 3 weeks, in a hospital catering environment where they learn about how food is prepared at a large scale for different clinical conditions. In year 2, they come back in September and do a core clinical placement for 10 weeks. This involves mostly acute hospitals, but also we have placements in the community. Again, for those that are interested in a career in the community, we try and put them on community placements. And we also have some time in the clinical nutrition industry for some students as well with that interest. Then after Christmas, they come back and do a 12-week final 3rd clinical practice placement, which has to be in an acute centre. A minimum of 400 hours has to be in the one site. So all of these are based in our university teaching hospitals. The dissertation, as I said, runs throughout the year, and there is 1 5-credit taught module, which is examined by an OSCE or a practical exam before Christmas of 2nd year. So these are our 3 practice placements. We're required to give 1,000 hours to each student. So placement 1 is 7 weeks, placement 2 is 10 weeks, placement 3 is 12 weeks. And you can see the 3rd one is in the acute hospital, like I said, but placements 1 and 2 are in more community health promotion industry sites as well as acute sites. So we have a memorandum of agreement, which is a legal document that we have signed between UCC and the local teaching hospitals. So our main core trainings place would be Cork University Hospital, probably the largest dietetics department in the region. We also send students to the Mercy University Hospital, the South Infirmary Hospital, University Hospital Kerry, University Hospital Waterford, and University Hospital in Tipperary. We also work with other organisations such as the Cope Foundation, and we have community placements in CHO Area 4, and I suppose they would be the main hospitals that we have agreements with, which means that we have a set process in place whereby they will take a certain amount of students per year. So there's no last minute panicking or placement sites pulling out, and we're very lucky as well that in the years that we prepared this course, we negotiated 5 senior dietitian posts in these hospitals, and their entire role is to support our students when they come out on training. So we have 2 seniors in Cork University Hospital whose whole role is to support our students in training. We have 1 in the Mercy, and then we have 0.5 spread between Kerry, Tipperary, Waterford and South Infirmary. So that means that there is a senior dietitian preparing and waiting for the students to arrive and supporting them throughout their training. And in addition to this, then our 2 practice tutors, which are UCC employees. You met one of them today, Jean-Anne. These tutors then help the students prepare all the forms and paperwork required. They visit them out on sites, and they run tutorials on a Friday when students come back to campus. So at UCC, we have a variety of resources and facilities available to train dietetic students, including a very nice clinical treatment area down in the School of Medicine, outpatient facilities, conference facilities, a state-of-the-art library with, because we run an undergrad in nutrition, there's a vast number of books and journals available on the topic of nutrition and dietetics, as well as some food skills training kitchens. In terms of Carew, which is another common question we get, when will the course be approved? It's important to say that no university can open a course in dietetics until they have their first cohort of students on site. We cannot start the Carew process. So you cannot get Carew approval before you open your course. You start into the process when you get your first cohort of students. So last September, we got our first cohort of students and we started into the Carew approval process. We spent the year teaching these students and we submitted extensive documentation to Carew in June of 2021, so this year. Carew then review that over the course of the summer and they write to the college with their feedback and they visit. We had a 2-day visit with Carew on the 13th and 14th of October. So the review panel looked at all the documentation. They met with the staff, they met with the students, they met with the tutors, they met with the clinical practice training sites, and they just reviewed the entire course and how it's run. I have got just correspondence in the last week from Carew to say that we've met all of the criteria for approval, bar one very, very tiny thing to do with doing some nutrition for non-nutrition students, which I'll touch on later. But basically, I can't tell you we've got Carew approval now, but it's pretty much 99.9% guaranteed that we will, but we won't get the final letter to us until January of next year. And then there's a 6-month process to put the UCC course into the Carew bylaw so that it's a legal agreement now between Carew and UCC, and that all our graduates can go on the register when they finish in August. So it was a long, drawn-out process. It involved a lot of hard work, particularly from the staff in UCC, and of course in collaboration with our clinical partners. And we're thrilled to be nearing the very end of that process now, and to allow our students to go straight onto the Carew register when they finish. So at the moment, the language on the website is that we're waiting on approval, but it is very, very close at this point. In terms of the application process, I'm just going to quickly touch on this, and then there's lots of questions coming in here, which I'll address at the end. So if you're applying to UCC, clearly you need to study the information on the website. We do have a contact form, but really I often say, please see the website. We've put up some videos where we explain pretty much everything that we can. There's an FAQ section as well. So you should be able to get all the information you need from the website. If you're applying to other universities, and we absolutely would encourage you to apply to other universities because all of our class sizes are small, you need to look at the individual guidelines for each university because they can differ from site to site. So only though apply to universities that you're prepared to study at. There's no point putting in 10 applications. It will take a ton of time trying to submit them all online and fulfill their individual requirements. So choose where you think you'd like to live and study, and then apply to those universities and look at their websites. We are currently open for applications at UCC. You can apply on ucc.ie/apply, and they will ask you to set up a short profile and enter in kind of details around your name, date of birth, address, etc. And then when it comes to the application stage, there's a little bit of homework involved before you're ready to put your application through online. So first of all, if you are coming to us from outside of UCC, so your science degree was at another university, we will need to see copies of your transcripts and they will have to be uploaded to that website. For UCC graduates, you do not have to do this because we already have your transcripts on file. So we have those. So everybody will need their transcripts uploaded. If you're currently in 4th year and applying, you just obviously need your transcripts from year 1 to 3. So we know that you won't have your degree on time. So you just put up your transcripts from the first 3 years of your degree. And if you are made an offer for a place, it will be conditional on you achieving a minimum of a 2-1 in that degree that June or July. And if you don't meet that, unfortunately, the offer will be pulled because it was a conditional offer. So that's how we judge academic transcripts from students that are currently in 4th year. You will need, for the UCC programme, 2 letters of recommendation. One needs to be from an academic, a lecturer or professor that knew you well during your undergraduate programme, or maybe you've already done a graduate degree. And I really can't stress how important these letters are. You are scored on all aspects of your application, and we use the scoring to determine who we will interview. So you need to put in a strong application, and those letters need to be quite strong. And I'll touch in a minute on, things that we like to see in these letters. So one comes from an academic and one comes from a professional reference. So this could be a work placement you did on your undergraduate program. It could be a part-time job that you have, but it needs to be a professional reference from someone that can vouch for your character in a professional capacity. So it does not have to be from a dietitian. Sometimes it is, sometimes it isn't. It really depends on the case. You're also asked to submit what we call a motivation statement or a personal statement, which is between 500 to 1,000 words. And again, I'll touch on that in a second, what makes a good personal statement and what makes more of a weaker one. And you'll also have to submit your CV. And in this CV, try and look at this carefully and get some advice from the skills centre in the university that you're at. They often give a free service to students, helping them to improve their CVs. And I really would encourage you to avail of that free opportunity. But in your CV, you're obviously going to document your academic path to date. And also in this, it's nice to see students talk about any volunteering work they've done, any relevant experience, any shadowing, including attendance at open days. List the names of the dietitians that you heard from today, and say that you heard Eileen Duff, who's a senior dietitian, speak about her career in renal disease. So those kind of things are important. And you also might want to mention them also in your motivation statement. So in terms of the letters, you need two, one academic. I really would encourage you to think carefully about who you ask, because sometimes students submit academic references and it's quite obvious to us when reading them that the lecturer did not know the student at all, and that they're very, very generic. It might say something like, Mary Murphy achieved a Bachelor of Science in Nutrition at our university from 2015, 2019. She was a very good student. She got a 2-1. She attended well, participated well, and I wish her best of luck in her application. That's quite a generic reference. It doesn't give any insight that the lecturer knows you or can vouch for your character or work ethic. And so really try and pick someone who you feel got to know you during your time there. It may be your program director of your undergrad, but likewise, it may be another lecturer that maybe you did your final year project with, who you worked with one-to-one with, and you would feel would know you a little bit better. I get asked to write a lot of these, probably because for a long time I was the only dietitian on the academic staff in UCC, so a lot of students would ask me to write them. And of course, initially you have to email that person, ask permission for a reference or request a reference. And once they write back and say, yes, I'm happy to write your reference, I always think it's really, really helpful for that lecturer if you can follow that up with an email where you help them to write the letter. So for example, you might want to, you could attach your CV if you want, but what might be actually easier for them is if you write a paragraph of achievements that you've had. Maybe you've been in receipt of scholarships for a good academic performance. Maybe you've been a class rep. Maybe you've done specific projects that lecturer mightn't know about. Maybe you work, as a volunteer in a nursing home or with Cork Penny Dinners or with the Special Olympics, or students do all sorts of things. Put that in the email to that academic and ask them to maybe incorporate some of your achievements into that letter. It will make for a much stronger letter that will be scored more positively when we come to the scoring stages. Also, we ask in that academic reference that the lecturer makes some prediction of the degree bands that you will land on. So if, for example, you're on a 2-1 in third year and your grades are kind of in the 60s, but you feel that it's within your capabilities to get a first class honours in your fourth year exams, talk to your lecturer about that and ask them if they could maybe try and say that in the letter, that it's well within your reach to get a 1H in your final exam. So that kind of thing as well adds weight to the letter. The professional reference, as I mentioned, can come from an employer. We see lots of students who have part-time jobs, for example, working as a pharmacy assistant, where they're interacting with the public and they're getting experience of dealing with the public. And all of those kind of things are important. And if you can get a professional reference, or whether it's from a work placement, that's the second reference you need, and that's also going to be scored. For the personal motivation statement, we ask you to describe your motivation and readiness for the programme between 500 to 1,000 words. So I suppose it's important to say here, we don't review individual personal statements. So whenever a student asks me, you know, can you take a look at my personal statement? I just don't do it as a blanket rule, because it is personal to you and it needs to be written by you. So get someone who knows you well, whether it's a parent or a sibling or a friend, to read it for you and give your feedback on it. Because if I gave feedback on all of them, they'd all end up pretty much the same. So it's important that it's unique to you. It's also important to say that the majority of applicants to our programme, I'd say well over 90%, are academically very highly qualified. And so the only real way that we have of getting to know them on their paper application is through their motivational statement. So this allows us to differentiate between 40 different applicants who all have an undergrad in nutritional sciences. So they're all the same on paper with the same qualification. What differentiates them? It's the personal statement. So in your personal statement, describe why you want to do this, what you've done to date to get you to that point. So what degree have you done, or what other things have you done to get you into this area? Give us some insight into the profession. So have you sought out, you know, I know shadowing is impossible at the moment with COVID-19, but have you been able to speak to a dietitian on the phone? Have you watched open days? Have you watched specific webinars or free conferences that I'll touch on later? There's lots of opportunities online now for you to get exposure to dietetics without going into a hospital and shadowing. Where would you kind of see yourself in 5 years? So help us think about you as a person, as a member of our profession. So all that kind of stuff can go into your motivation statement, as well as any volunteering work or things you've done to set yourself apart from other people, whether it's volunteer work, you know, class rep work, or maybe your part-time job that's relevant. Put that into your personal statement as well. So consider all your interpersonal skills. Non-academic achievements are important. Some students have great sporting achievements. They've been part of a team. They're used to teamwork, etc. So it's unique to you, but do spend some time writing this. And as I said, seek advice from someone who knows you well, whether it's a family or friend. For your CV, I would really recommend that you get advice from your university's career department, or sometimes it's called a skills centre. There are people employed full-time there to help students to get jobs or help them get into programmes and help you work on your CV. It will focus on your strengths, and it will really be a much, much better CV than if you just try and attempt to do it yourself. Having said that, some students do a fantastic job of their CV just doing it themselves, but other CVs, I guess, are weaker. And often I see CVs of students that I know well, and I feel like, why didn't he or she put all this information in? Like, they had so much else going on, but they forgot to put it into their CV. So try and make sure your CV is comprehensive. If you attend webinars or, you know, online conferences or anything to do with dietetics, put it into your CV. Give us a reason to give you a high score on your CV. List all the other activities you've done. And this is becoming, I guess, the main differentiating factor between a generic application of someone who hasn't done a whole lot with a student who really has a passion for the profession and has gone above and beyond to try and get into it. So talking to dietitians on the phone, attending webinars, open days, shadowing, college projects. Some students actually opt to do their third year work placement unpaid in a clinical environment or with some kind of human dietetic-y type exposure in preference to a paid placement in the food industry. And of course, we have to give acknowledgement for that if someone has taken an unpaid placement over an offer of a paid placement. So some students are lucky like that they will get some experience during their undergraduate degree. So shadowing is kind of out of the question with COVID-19. I have asked for it in all of our teaching hospitals. I've asked, could you possibly take students for a half a day? And people reply to me very nicely and just say, I'm sorry, we can't. There's a visiting ban on the hospital. You know, we can't have staff in, students in that are unnecessary. So COVID-19 has wiped out any form of on-site shadowing for the vast majority of students. And it was the same last year. But what I found last year when we interviewed students, and we interviewed 30 of them, a lot of them had actually arranged a phone call with a dietitian where they got to hear about their job. And likewise, you can get that kind of exposure through listening to open days, including the one on the IMDI website. Some students do charity work. I've seen lots of students work in Cork Penny Dinners, with homeless centres, and they've done work with Special Olympics Ireland, with Cope Foundation. Some students do fundraising for different charities. All that kind of stuff is important. Some actually are able to volunteer with either a research group in a university or with a private practice dietitian or a sports dietitian. But again, those opportunities are very, very few and far between. Webinars are going to be your friend. So I suppose, how do you find out about these? I would encourage you to follow as many dietitians as you can on social media. There's quite a lot of them now that are active on social media. You can follow the INDI on Trust INDI on Twitter and Instagram. Also, there's a group called Emerging INDI or EINDI, which is a group of student and newly qualified dietitians who are very active on social media and listen. What are they tweeting about? What are they putting up on Instagram? What are the kind of issues going on? That's how you get your feet on the ground and figure out what's going on. I'd also encourage you, if you're applying to programs in the UK or in Ireland, follow the program directors or lecturers from that university in the area of dietetics. See what are they tweeting about. What if they're using Instagram, what are they putting up? They'll often publicize free webinars and free events that you can attend to give you experience. Sometimes they share results of their research findings, for example, so you get to know the university that you're going to a little bit better. Although having said that, I realize a lot of lecturers are not on social media, and so you need to try and figure out the ones that are. But certainly the program directors in both UCC, UCD and UL all use Twitter, certainly, and also I would advise you strongly to follow INDI. They tweet about all kinds of things. So mention all of these things in your CV, also mention them in your personal statement, and don't forget about them either at your interview. So when we interview students, they've got a 10-minute interview to try and sell themselves and put a face to the application. So don't just presume that we've read these things in your application, because we interview 30 people over 2 days and it's literally bang, bang, bang. So at the interview, make sure you say these things again, because the interview will also independently be scored. So last year we had a very short window of applications in UCC. I think we were only open for about 6 weeks, and we got 105 applications. We don't even look at them until the closing date has passed. So there's applications coming in at the moment. I don't even look at them until the deadline has passed. And I think the deadline is the 20th of January this year. So after the deadline is passed, you typically have about 2 weeks to upload any documents that need to be uploaded, like transcripts or references. But then come February, we will begin to look at the system and look at the applications, and there'll be a panel of staff look at them. So they're not just scored by one person, they're scored by a panel. And of the 105, or we may even get more this year, we don't really know. We're trying to shortlist about 25 for interview, so we can't interview them all, unfortunately. So about 25 to 30 will be called for an interview. And how we shortlist is that we score the paper application. So we give certain points for your background. We do give an additional 5 points if you have an undergraduate degree in nutrition. So students with a nutrition background do score slightly more. It's out of 100, so it's just 5 points more. We also give points for honours bands, so students on a 1H get slightly more than students on a 2-1. Unfortunately, we can't consider any applications with a 2-2 just because of the demand for the course. We then check the transcripts to make sure that you have the correct background, you have a science degree, and that you have enough credits of biochemistry and physiology. So we forensically go through the transcripts to make sure that you meet those credit requirements. Then once you got past that stage, we then begin scoring the application. So we score the personal statement, the 2 letters of reference, the CV, and we also look for this kind of other box to be ticked if they've done any other activities to show interest in the profession. So we shortlist about 30 for interview. These interviews happen typically in February of every year. The reason for this is that we like to give students an early decision so that they're not applying to multiple courses in the UK. It's nice to know you've got a place. And so for that reason, we try and get the results out earlier in the academic year so students can make plans. The interview is 10 minutes long. We will continue to do them on MS Teams next year. It just works better than in person. The interviews happen over the course of 2 days, and there's usually 2 academic staff on the interview panel. And what we're trying to do really is put a face to your application to get to know you. We're especially interested in trying to evaluate your communication skills, because communication skills are obviously so important for a dietitian. So can you speak to us? Can you tell us about yourself? You'd be amazed at the amount of students that we interview who have lots written on paper but just are not able to communicate. And some of those students possibly would benefit more from a 4-year undergrad program where they have more time to develop those kind of communication skills. So in an accelerated 2-year master's, really, we're hoping students are coming in with already good communication skills. And we're looking for some insight into the profession. So, we ask different questions every year, but a question that we asked last year was, what do you think are the major challenges facing the profession? And some students couldn't think of anything, whereas others had fantastic insight. COVID-19 being an obvious one, because we're wearing masks and we're using a lot more telemedicine, but a lot of students didn't even think of that. So think about these things before the interview, and try and help prepare yourself as best you can. The interview then itself, we're looking at non-verbal communication, we're looking at your posture, we're looking to see, can you communicate, that you smile, that you seem personable. So we want to know, will you get along with patients? Can we send you out to hospital and community sites? Will you get on with the staff and the patients? We want you to represent our university well on placement as well. So we want to see, can you communicate well? Are you a pleasant type of person, or do you seem quite withdrawn and that? So it really helps us to get to know your personality when we interview. And I personally think the interviews are a hugely important part of the process. Signs on are 2 classes, actually. We've first years and second year groups. They're absolutely fantastic. They're a pleasure to have in class. They're not afraid to interact with us or with our guest lecturers or with our patients. And I think the interview really helps to select out students who have those really good skills. The quality, you might be asked questions on what are the qualities of a good dietitian. You'll certainly be asked, why do you want to become a dietitian? But you might be asked about the qualities of a good dietitian. So all about being able to translate scientific information into dietary advice and being a really good communicator, and having empathy as well without being patronizing. So having empathy because you're working in a variety of clinical areas where people may have received bad news, etc. Good rapport, good interpersonal skills, good listening skills, being a good motivator, being able to use behavioral change to try and incite lifestyle change, and enjoying working with people, I guess, is the most important thing. But not just healthy people that are also sick and unwell, particularly in the clinical setting. A good team worker as well is important. And the better students at interview are able to give examples of these types of skills and how they have demonstrated these skills in the past through work experience, volunteer work, or through college work. So the good students will give you lots of examples of why they have these individual skills. And we obviously want you to be able to uphold the good reputation of the profession and, of course, the university. So we want to send out students to our sites that get on well, because we want to keep those sites for future students that we will train. We want you to act in a way that you can have trust and confidence, that you'll protect confidentiality, that you're anti-discriminatory, that any documentation is clear and concise, that you're able to work as an autonomous professional, and also that you will engage in continuous professional development going forward, and continue to study throughout your career, and not just leave all that on the day of your graduation. So typical questions we ask at interview are things like, why do you want to be a dietitian? What do you enjoy studying in dietetics? Was there a particular thing in your undergraduate program that sparked your interest in this? How will you keep your knowledge up to date? How do you feel the role of the dietitian is within the healthcare team? And hopefully you got some insight into that today. Where do you see yourself in 5 years? Some sites, not particularly UCC, but some sites in the UK do like to ask more specific questions about, have you ever been in a situation where you got constructive criticism and how did you deal with it? And another very common question is, what are the main challenges for facing the profession? You'll get a real insight into that by following dietitians on social media, because they'll tweet about things that they're passionate about. So again, try and follow as many as you can and get an insight into what these challenges are. Can you give examples of when you functioned well as part of a team? And it's all about giving examples in a good interview. So can you give problem solving examples, conflict management examples? Are you dependable? Are you organized? Have you shown leadership in the past through, class rep roles or anything like that? Are you good at time management? Are you good at making decisions? Are you good at critical thinking? This is all the kind of language that we like to hear students use when they talk about their own particular individual skills. And what skills are important? You're going to be managing a busy workload. So things like time management, planning, prioritization, asking for help, not being afraid to ask for help. These are all things that we like to hear students say at the interview, but again, backing them up with examples from their own lives and their own backgrounds. So at the end of the interview, we're hoping you've answered all the questions fully, that you didn't undersell yourself. So it must feel awful to come off an interview and feel like you could have done better. So really prep for it, practice in front of a mirror, practice in front of anybody in your family who's willing to listen to you. Make sure, you make out a list of things you've done, your previous experience, your personal interests. It could be something to do with sport. It mightn't necessarily be dietetics, but try and look for real life examples of some of the skills that I've mentioned and use those as much as possible. Point out your special strengths. Don't just presume that we've read it on paper. We need to hear it again at the interview, and try and come across as kind of a positive person with confidence and good communication. So that's the end of the slideshow there. So I'm just going to now go through any questions that have come in. There's quite a good few emails here actually, which I'll go through now. So actually, I'm not too sure, is Mairead Kennedy on the call, one of our students? If you are
hi, Aoife, I'm here. I just got in.
Thank you so much. So Mairead is in first year, and she's in the middle of a lab. We're so grateful that you came along. Could you, for like just a few minutes, tell the students how you're finding the course, how you found the application, maybe?
Yeah, I'll start at the start. The application was good. I definitely would say put time into your personal statement. It is really important to make it personal to you, include skills that you learned, and include why you want, like what makes you passionate about dietetics. I think it gives the interviewers like very good questions to ask you, and even what to expect from you. Also, the personal statement is very important, and I'm sure Aoife said that already. And then the interview, don't be too nervous for it. The questions are what you expect them to be. Have prepared. And yeah, just try put your best self across, I suppose. But yeah, and like it is a vigorous process and long process, but like everyone that really wants to you will get a space, and don't be too nervous. Yeah, I did. Like, I'm so glad I'm here, and it is very busy. The first semester has been really good, and like everybody in the masters are so nice. We're all the same kind of people, and it's been really nice to make new friends and to meet everyone. I believe next semester will be more busy, but the last 2 weeks are quite busy now with assignments and stuff. But it's great, and I cannot wait to get out on placement next summer.
So
and if anyone has any questions about the process or anything, they can get on to email Aoife, and she can give you my email. I have no problem helping you with anything, because I had help from other students as well in the year above us, and also a student in UL. So if anyone wants any information.
Great. Thanks. Mairead is actually our class rep, so it's very nice of you to join us today. I'll have a look through some questions. Maybe some of them might be for you, Mairead, if you can hang on for the few minutes. I know we're slightly over time. So one question, can you be registered in Ireland and the UK at the same time? Yes, you can, but you'd have to pay a registration fee. It's €100 a year to stay on the Carew register. I don't know what the fee is in the UK, so there wouldn't really be much point in being on two registers at the one time. You just need to be on the register of the country that you live in. The second question online is, some masters, especially those in the UK, are pre-registration. What's the difference? So that just means that they will lead you to the point where you can register. So it's the same thing. So you'll just be able to register then in the UK. We don't use that language in Ireland. It's very much a UK thing. It just means that it's leading to pre-registration, so you can register when you graduate. What do you suggest for undergraduate students who've been mostly online over the past 2 years due to COVID restrictions and have limited interaction with academic advisors in the college? Yeah, this is like really, really tough. But just to reassure you that everyone is in the same boat. Like for our third years, they've spent all of second year online and some of first year online. So we understand this, and guaranteed every application we get, everyone is in the same boat. For Mairead's group last year, when we interviewed, we were in the middle of lockdown, and the COVID pandemic had been going on since the March, so you guys weren't able to get any shadowing either, but yet we still are able to pick out the students who are still good communicators, and you can see Mairead as well able to communicate on a Teams call as well. So we're kind of looking for that and that positivity to come across as well, to be personable and to feel like, look, this looks like a really nice person who will be very empathetic with patients that are sick and will represent the university well. So yes, it is difficult to get experience, but there is a ton of free webinars online. My NutriWeb is a good one. Every month they do free webinars. They advertise it through Twitter. You can hear about a whole host of dietetics related topics. The INDI have a research symposium coming up in January, which is open to all people, not just INDI members, and you'll get to see dietitians present on a whole load of different clinical areas. So again, follow the program directors on Twitter, follow the INDI, follow the EINDI, and you'll see lots of opportunities for kind of online shadowing. And that's the situation everyone's going to be in this year. In terms of your academic reference, I mean, I guess if you feel like your lecturers don't know you that well, it's probably better to go to the program director and then help that person write the reference well. Send them a paragraph of your own unique skills and ask them to include that in the reference as much as possible. We feel bad that we don't know students as well as we used to pre-COVID, so help us to write it. And any decent lecturer is going to want to help you get into the program that you want to get into. I have loads of questions by email. So somebody asked, just wondering, when submitting the professional academic reference, do they need to be attached to the application form? So this year we have a change in the process. Last year, you to list your referees and an email alert went out to them and it was up to them to submit it online. And some of them came in really late or some of them didn't come in at all. And I personally had to chase down at least 20 references from people who didn't submit, from the lecturers who didn't submit them. And the student was none the wiser. And some of them got very stressed when they found out their references had not been uploaded. So this year, to avoid any stress, we are asking that you, the student, upload 2 PDFs, one of each letter. So the onus is on the student to ensure that the documentation is complete. So that is a change this year. So you will be asked to get the reference in PDF and upload it yourself. Another question here. Would you mind touching on whether it's more likely that people with a 1H undergraduate degree will be accepted over someone who has a 2-1? Not at all. I'm not going to ask Mary what she got. You know, we get a good, obviously, broad range of people with a 1H or 2-1. It's more than that. It's more about your background. So we obviously do have a preference for people with nutrition degrees. They tend to have a lot more relevant experience and a lot more knowledge of the area. So they tend to do better at interviews. They've better insight into it. They've done more projects and work placements, etc. We don't actually on the day of the interview look at the degree band and select out people with 1Hs. We're looking again at communication skills, what kind of things they've done, their insight into the profession. So once you meet the 2-1, we don't really mind if it's a 1H or a 2-1. And Marie, would you say your class is a mix of both?
Definitely. I think it's more about what kind of person you are than your results. Yeah. And like how much passion or how much you want to do dietetics and how you come across in the interview. I really don't think it's based on your results.
Yeah. I had another second question coming in on that exact same thing, so I think we've answered that now. What is an acceptable level of human physiology and biochemistry? So it's 10 credits of physiology. This could be human anatomy, human biology, not plant biology, so it has to be human biology or human physiology. So any of those we're looking for. Biochemistry is the same. They come under different titles. Some of them are called nutritional biochemistry, some are just straightforward biochemistry. We're looking for 10 full credits of that. So do you need to achieve high in these to get in? No, we don't care about what degree you get in them as long as you've passed those modules. By the way, I didn't mention, if you are currently a student on an undergrad that's not nutrition, so say you're doing public health, say you're doing food science, there's a whole load of backgrounds that we get inquiries from, and you feel that you don't have enough biochemistry or physiology, the easiest time, I guess, to do it is while you're an undergrad, because you can carry additional modules free of charge, or not free of, usually it's free of charge. So it just means carrying an extra module, maybe in 3rd year and 4th year, but it's probably faster and cheaper than waiting until you finish. If you're in 4th year and you haven't done enough biochemistry, this is often the case with food science degrees. Nursing is another one which wouldn't have enough biochemistry, and we get quite a lot of interest from nurses. You can take these modules as standalone modules under the UCC Flexi options. So if you Google UCC Flexi options, you'll be able to register for one of those modules. Now, they're only taught during term time, so semester 1 and semester 2, so they're not offered over the summer. So maybe look into that if you feel you're short, and you could maybe take them in semester 2. Another question, since placements are unpaid, is there any financial supports? Because this would be a major restriction. Also, would the placements be within the Cork area? So yes, placements are unpaid. You're very much a student, you're very much learning. You're not contributing to the staff of the hospital. Maybe the last 2 to 3 weeks of your final placement, you're given a caseload. It's called consolidation, where you're given a caseload and you have to look after those patients, but everything is still being co-signed in the medical notes from your supervisor. So you're not really an autonomous healthcare professional. That's why they're unpaid. Unfortunately, we do not have any scholarships at the moment. I know the fees are very high for all of these programs, but these programs are barely ticking over financially. We're not making any profit out of them at all. If you saw the budgets, in fact, we've had to take in some additional people into our undergrad to try and keep the dietetics program open. So it's not that we're making a whole load of money out of you. We're charging you the rock bottom price, sorry, the lowest price we possibly can charge. And at that, we've had to take in extra students into our undergrad to try and prop up the dietetics course. Another question here, saying they enjoyed it. Thank you. So as a career changer, what MSCs will suffice to apply for the MSc in nutrition? So this person is a solicitor. Yeah, it's very difficult for people without a science degree. You have to have a science degree for every single program in Ireland and the UK. There is no way of getting into a master's without an undergrad in science. So the fastest option for someone like you is to do an undergrad, I'm afraid. And there are 3-year programs in the UK. Now, this person has a small baby, so that's a huge decision then to move country with your family. So it's probably not an option for you. You're asking, can you do it remotely part-time? Unfortunately, you cannot. The only country where you can study dietetics part-time is in the US. So I used to be a lecturer on the dietetics program at New York University, and all of our lectures were in the evening. And students could work during the day and take different modules over the course of many years. It was very flexible, but unfortunately, we don't have any of that in Ireland or the UK. And in fact, it would be quite problematic. You couldn't do a part-time placement, for example, because you have to complete a certain amount of hours over a certain period of time. So yeah, if you don't have a science background, I'm afraid the fastest route for you is an undergrad. It's going to be very hard to get into that in Ireland, certainly. But if you do want to go down the postgrad route, you're looking at doing some kind of science degree. Maybe you could find a 3-year one and then into a postgrad. So you're looking at a minimum of 5 years, I'm afraid. How many places? We've 14 places next year. We'll probably stay at 14 for a while, actually. Can you run through the options available for funding grants studying as a mature student? So if you're a mature student and you're living independently of your parents, you need to go onto the SUSY website and enter your own individual details. It's different if you've been, living on your own and your income is under a certain level and you're not dependent on your parents. You may qualify for a grant which would cover a lot of the fees. That's often, I don't get involved in the student grant aspects of it. You need to deal specifically with the grants office on that, and SUSY in particular have quite a good website, and it allows you to enter in your details and it will give you some indication whether you qualify or not. We don't have any scholarships at the moment either. I would say the fees are paid in instalments. Am I right, Mairead? Is some in September, some in December? Is that how it goes?
Yeah, I think it's September and January, but yeah.
Yeah, so it's about half at each stage, is it?
Yeah, I think it's a small bit bigger in September, but roughly half, yeah.
Yeah, so I guess a lot of students take out student loans, or some are lucky that their parents can help. But at least at the end of the course, you're pretty much guaranteed a job. So and hopefully be permanent within a very short period of time. So hopefully you'll be able to pay back some of those loans. I think I've answered. Okay, I've answered. Oh, there's 2 more here and I'll come to the chat. Do you think students who take a year out after completing the undergrad to gain experience are at a disadvantage? Not at all. We have actually students in the class at the moment who did their undergrad maybe 2-3 years ago and have been working, and they did fantastic interviews. They got into the course, they had really relevant experience, they had spent some time working, they had decided it wasn't for them, they had tried to improve their CV to apply to the program, and they brought maturity. We love teaching on a master's program. Our students are a little bit older, they're more mature, they interact much better with lecturers and tutors than some of our undergrads, which can typically be very, very shy and nervous to ask questions, for example. So no problem at all taking some time out. Now, if you took a lot of time out, like if you're 5, 6, 7 years out of your undergrad, that could be a different issue, because we would start to wonder then at that point, have you still got the knowledge of biochemistry and physiology that you would need? There's only about 3 questions left for anyone who's still on the call. What do you suggest for undergraduate students who have been mostly, I answered that one. Would you have an equal chance of getting in with a science master's as opposed to an undergrad science degree? Yeah, so we do give, I think it's an additional 5 points for people with a postgraduate degree already. So if you have a master's in science, you'll get slightly higher scoring, but in the context of 100 marks, it's not that big. The personal statement, the letters, the reference, all that is much higher weighting. So yeah, if you have a master's, you'll have a slightly higher score. Is there a difference between human nutrition and UCD and nutritional sciences and UCC when trying to get in? No, there isn't. Both of those courses are very, very good courses on nutrition. They give you a really strong foundation for going into a master's in dietetics. So if you don't think you're going to get the points for the undergrad, definitely my advice to you would be do a nutrition degree from a good university, a good program, and you'll be in a great shape to get into a dietetics master's then. And the last question, I think, when you say students with nutritional science undergrads would be considered more, would this be the same for students currently in nutritional science postgraduate degree? I presume you mean the postgraduate diploma in nutritional sciences. Yeah, so any qualification in nutrition, whether it's at undergrad or postgrad level, is going to score ever so slightly higher than someone, for example, with a degree in nursing or public health or biochemistry. But really, it's a very small amount of points. It's only 5 points. So most of it is going to come down to your overall application and your letters. Yeah, sorry we went slightly over time today. I hope we've answered all of the questions. If you have any other further questions after the call has ended, you can send them on to me. And if you have questions specifically for a student on the programme, I'm happy to forward them to Mairead, and grateful that Mairead has offered to do that as well. So we'll edit the recording, trim down the beginning and end, and we'll upload it to our website in time. So thank you everybody for joining today, and again, thanks for your interest in our programme.